We are live now.
Yes.
Good evening, esteemed faculty members and all the delegates. Thank you for joining. This is Sahiti on behalf of Sheer Connect, welcoming you all for today's webinar. And today we are back with our series Bed Mocha Meetup Season 1 and Session 16. And today's topic is Achieving Positive Sexual Health, a Comprehensive Approach, Empowering Couples Through Holistic Therapy. So it's my privilege to introduce the organizer of today's webinar, Dr. Ritu Santwani Ma. MBBS, MD, FICOG, FIOG, MRCOG, ART in Singapore. Ma'am is consultant obstetrician and gynecologist, infertility specialist, sexologist and cosmetologist. Ma'am is founder and CEO of 360 Degrees Healthcare Studio. Ma'am is part of NUHS Singapore, co-founder of MAAM and board member of SWWC. Ma'am is the top 50 influential doctors on social media. So I welcome you, ma'am, and I hand over the session to you.
Yes. Yeah. Thank you, Sahiti, and thank you, Shield Pharma, for providing the platform for this program for last 3 years. A very warm welcome to our esteemed guest for today, Dr. Sita Madam. Friends, as we all know, knowledge is power, and knowledge always increases by sharing. The only motto of starting of my program is this. I started this program 3 years back, and with the blessings of my Mata Rani, still this program is rocking. Not only the national level, but also the international levels. We are able to see that a lot of international doctors also join. So today we are having a very important topic, that how to deal with the patients of the sexual health by the holistic approach. Being practicing in a metro city, yes, a lot of the patients are coming, the Google savvy patients are coming, they are telling, no ma'am, we don't want to take any hormonal things. We don't want to take sildenafil, tadalafil, depoxetine. We have all read about this. There are a lot of side effects. So now what is the holistic approach for that? So to discuss for that, we have invited today a stalwart from this industry for this field is Dr. Sita Lakshmi Madam. May I request Sayati to do the honor to...
Yes,
Yeah.
ma'am. It's my privilege to introduce Sita Lakshmi ma'am. Ma'am has done MBBS, MD, DGO, FPSM. Ma'am is renowned gynecologist and sexual health consultant. Ma'am is innovator of Dr. Sita's batch therapy. And ma'am is the YouTube influencer with over 1.3 million subscribers. Ma'am is hypnotherapist, sexual education advocate, seminar leader for pre and post-marriage workshops and seminars, counseling and psychotherapy, public speaker on Doordarshan and other platforms, wellness and relationship coach. Ma'am is also the director of Dr. Sita's Mind Body Care, Thrissur, Kerala. Ma'am has been affiliated to Thrissur Obstetrics and Gynecology Society, life member of International Association of Sexual Medicine Practitioners, life member of PCOS Society of India. I welcome you, ma'am, and I hand over the session to you.
Once again, a very warm welcome, Dr. Sita, madam. This lovely rose is for you to welcome you. By the virtually,
Thank you. Thank you so much, Dr. Ritu. Thank you so much.
Most welcome.
Yeah, so I'll share my screen.
Yes, yes. We all are eagerly waiting to hear you.
So how do I share like this only, no?
Yes, ma'am, we can see your slides, ma'am.
Yes, yes.
Yes, I'll start. Okay. Good evening, everyone. I'm Dr. Is it audible?
Yes, loud and clear. Yes.
Honored to be here today. Thank you, Dr. Ritu, for giving me this opportunity to speak about a topic that is very close to my heart. When we practice as sexual health consultants, what all must we be doing? A detailed history taking, a battery of investigations, and after diagnosis, prescribing medications or doing some surgical intervention, and then just leave it at that? The answer is a big no. Yes, you guessed it right. It's our duty to help our patients move from dysfunctions towards positive sexual health. Don't you all agree? But then, how are we going to do that? Is it even possible in our Indian scenario where the word sex and I'll elaborate on how we are making it possible at our center.
Sita, ma'am, there is small disturbance, ma'am.
What we are doing.
And the video is also not.
Yeah, 1 minute. 1 minute.
Okay, ma'am.
Hello? Now also there is disturbance? Well, I think there is someone speaking. 1 second.
Yes, madam. Yes, madam. Mute them, ma'am.
Okay, ma'am. Okay, sure, sure.
Was the video clear?
Uh,
Because I didn't want any pictures. 1 minute. 1 minute. Good evening, everyone. I'm Dr. Sita Lakshmi, and it's an honor to be here today. Thank you, Dr. Ritu, for giving me this opportunity to speak about a topic that is very close to my heart. When we practice as sexual health consultants, what all must we be doing? A detailed history taking, a battery of investigation, and after diagnosis, prescribing medications or doing some surgical intervention, and then just leave it at that? The answer is a big no. Yes, you guessed it right. It's our duty to help our patients move from dysfunctions towards positive sexual health. Don't you all agree? But then, how are we going to do that? Is it even possible in our Indian scenario where the word sex and anything related to it has got a lot of taboo and stigma? In the next 15 minutes, I'll elaborate on how we are making it possible at our center in Thrissur, Kerala, how it all started, what we are doing currently, and some related data. After focusing primarily on obstetrics and gynecology for more than 20 years, I started practicing sexual medicine only 4 to 5 years ago. Back then and now, patients come to me after watching my informative videos in YouTube. Initially, the majority of couples who approached me had vaginismus as their primary issue. And I suppose they came to me because I'm a gynecologist and they wanted a baby as soon as possible. About 150 to 200 couples with vaginismus must have approached me between 2020 and 2022. For mild cases, simple counseling and guidance were sufficient. For moderate to severe cases, I implemented pelvic floor exercises, thigh exercises, and the use of fingers and dilators. It was around 50 to 60%, and many patients didn't follow up after a couple of sessions, and many did not inform me whether they were successful or not. Despite this, I was happy with whatever success I was getting. Slowly, men and women with other sexual issues like desire, arousal, orgasm disorders, erectile dysfunction, premature ejaculation, etc., started coming in. I continued learning and expanding my knowledge to manage these patients better. Since the last 2 years, we are offering in-house residential therapy in batches for couples with moderate to severe sexual dysfunctions, which has had transformative effects. My inpatient therapy journey started with a challenging case in mid-2022, which laid the groundwork for our current approach. When a Malayali staff nurse couple from UK who were on 4 weeks leave requested me to admit them and cure them of the mammoth problem in their life, vaginismus. I was unsure if such severe vaginismus as she had could be managed in such a short time. I tried my level best to dissuade them, citing numerous excuses. But they insisted that they want treatment only from me. So with a sigh, I started developing plans as to what to do with them. I read extensively, made notes. At that time, I did not know of many people who practice sexual medicine in our country. I knew only Dr. Nilima from Pune, and even she did not know what advice to give me for in-house management. By the time the couple arrived, I was haggard due to lack of sleep, had after ulcers in my mouth. The responsibility was huge due to the complete trust they had in me. I was transparent with them about the challenges. I took anticipatory bail that I cannot guarantee success. We reassured each other. We even did breathing exercises together as part of the treatment, However, by the end of first week, they had made significant progress. They motivated other patients also who were consulting me on an OP basis during the time period they were there. Every day, we discussed various aspects of couple relationship and how to improve on it. It was a good learning experience, not only for them, but for me also. On the 17th day of treatment, they were able to consummate their 5-year-old marriage, and our entire clinic rejoiced. Word spread that we were not just dealing with sexual issues, but we were educating couples on other important aspects of life, as almost all the couples were willing to give testimonials in some form, and most of them were willing to talk to new patients who took consultation for similar issues. And soon, more couples started seeking admission, eager for the same transformative experience. But I was skeptical as I was unsure whether the results could be replicated with all couples. And I was careful about whom I accepted. And after a couple who had both primary erectile dysfunction and vaginismus also completed their treatment successfully in 20 days, my confidence increased. To accommodate the increase in demand, we started batch therapy, which turned out to be the most effective approach and a game changer. We transformed our hospital into a dedicated space for couple therapy, ensuring privacy and a supportive environment where the couples feel safe, understood, and respected. Group discussions became the crux of our treatment as couples found comfort knowing that others also shared their challenges. We now take in couples with moderate to severe sexual dysfunctions, be it vaginismus, erectile dysfunction, and both conditions combined. Of this, more than 95% have not consummated their marriage yet. We also handle cases where the couples have severe sexual discrepancies, those who have children but no intimacy, and couples struggling due to unresolved issues between the partners. In the last 2 years, we have had 82 couples who took this in-house therapy across 13 batches, and we have more than 50 couples who are waiting for admission in the next 6 to 8 months. We have a long waiting period these days. The average duration of a treatment is 60 to 70 days. The success rate at the time of discharge has been consistently 100% with regards to ability to have penetrative sex with confidence, to do sensate focus and enjoy it too, to arouse and get aroused, alleviation of the anxiety related to pain, erection issues, etc. And more important than that, other aspects of the couple relationship also improves dramatically. Our success comes from careful couple selection, ensuring that they are ready for therapy. We are also collecting data for research purposes. We realize and acknowledge that sexual intimacy cannot be created in isolation. We take detailed histories and ensure that physical, mental, and relationship issues of both the partners are addressed to a reasonable extent before admission. Before admissions, nutraceuticals, aphrodisiacs, some herbal supplements, vitamins, etc. are given. Some really help and some have just placebo effect. We also introduce a prospective matchmates to each other by a group called to build familiarity. After admission, the first group session is very important, I always feel. I emphasize on the aims and goals of a treatment program and the take-home messages that they need to understand on day one itself and set the ground so that their willingness and commitment to follow our suggestions will increase. Take-home message one is, even if one partner has a problem, be it related to sex or anything else, if both pitch in to solve it, results are faster and long-lasting and bonding increases between the partners. Thus, they are in readiness, well, at least to some extent, to do the structured exercises we have planned for them in a way that almost all of them have to be done by both the partners or with one helping the other. Take-home message two, it's a good thing that they've developed whatever sexual issues they have. For it's because of that they are getting the opportunity to learn so many things, not only about sex, but about all other aspects of married life also. This makes them start to think more positively right from day one. The take-home message three is there are different dimensions of couple relationship and proper prioritization is very important. This understanding helps and motivates them to participate actively in the group classes and interactive sessions we have. All the couples absolutely love the group sessions. I also love it. Take-home message 4. Sex is indeed a very important aspect of marriage and intercourse is not the most important thing. When I explain this to them with the help of some analogs, metaphors, etc., they become eager to learn the many things I am going to teach them. Take-home message 5 is to decrease their anxiety, whether they'll get individual attention in the midst of a bad treatment. Take-home message 6 is that we need not be serious all the time while we are tackling any major problem. Thus, they are open to doing a lot of musty and having fun. At the end, they feel they've had a holiday and amidst that, some treatment happened magically. The core principles of our treatment revolve around self-love and acceptance, partner love and acceptance, improving physical and mental health, enhancing intimacy through sensate focus exercises, psychosexual education, and group therapy. The list of activities we do is here. I will give a short description of each of these. Psychosexual education involves educating couples about sexual health, anatomy, and the physiological and psychological aspects of sexual functioning. The couples are open to having this together rather than having a ladies only session or a gents only session just after 2 to 3 days or even earlier. It is amazing. Sensate focus therapy developed by Masters and Johnson is a very important component of our treatment program. It involves a series of structured touching exercises progressing from non-genital touch to genital touch, and then to the penetrative act. As the couples are here only for 15 to 20 days, I've made modifications to sunset focus to suit their purpose. Our staff are well trained in teaching the couples pelvic floor therapy, and this is beneficial for both the partners. Specific yoga poses and thigh exercises can help stretch and relax the pelvic region, thighs, and back. We have daily morning yoga sessions from 6:30 to 8. My husband, Dr. Ramachandran, is the one who guides them for the yoga and yoga nidra. Systematic desensitization is particularly useful in cases of vaginismus. It involves the use of fingers and later dilators to gradually desensitize the vaginal area to penetration. Mindfulness and breathing exercises stimulate the parasympathetic nervous system, promoting relaxation of the mind and the body. Medicines like anxiolytics, antidepressants, muscle relaxants, nutraceutical supplements, PDE5 inhibitors for the husband where needed are all given as per need. CBT and other psychotherapies can help set new healthy patterns with regards to all aspects of couple relationship. We encourage them to have a healthy, balanced diet together in the huge dining hall where 20 people can have food together. Group sessions cover sexuality, communication, and conflict management. Here are some pictures of positions being demonstrated with the help of male and female dolls, soul raising, breath singing positions, etc. There are many more. Recreational activities like movie outings, dance, etc. also help couples bond outside the therapy environment. For selected cases, I do hypnotherapy and acupuncture. After the 10th day, shopping for suits, beauty parlor visits, mehendi, etc. helps build up the excitement. Currently, our 14th batch of 7 couples are almost nearing their D-Day, and we have now started a new exercise for them with flowers. No, not flowers on the bed. So let's see how it goes. And if this activity is really helpful, then this also will become part of our treatment. You know, all of these activities we did not have from first batch itself. I kept on adding new things with each batch, modifying the sequence, experimenting with so many different things. Towards the end of the therapy, we go to the beach where all the couples engage in fun, relaxing activities. This helps them to let go of anxiety and prepares them for the final intimacy of having intercourse. My God, the fun we have there. Here is another picture, yet another. These are some more clips from the beach, and the couples make us also post for pictures, and we feel that we have also started to reclaim our intimacy, which, like most couples, we had lost in between. And then finally, the D-Day. Some men may experience performance anxiety, but we are there to guide them through it. We make sure that they are successful at least a few times before sending them home. By that time, no one wants to leave and find excuses for staying back until the last couple leaves. So, batch therapy, which we have officially named as Dr. Sita's batch therapy, has been the game changer, and we are excited of the progress we have made. It hasn't been an easy journey, but with the help of my husband, Dr. Ramachandran, and our dedicated staff, we have created something truly transformative. We now have a SOP, a standard operating procedure, and our program is a very structured one, but flexible enough. We trust the process. I like to think of a program like a carefully made chain or a building block puzzle, and it's my brainchild. But the learning is far from complete. We are learning from each couple, each batch, asking for feedback, making whatever modifications we can, trying to gain more knowledge and insights, and enjoying it all. Well, not always. Sometimes it's really overwhelming and draining, and I feel like running away somewhere. This couple, I wish you all to participate in their joy for a moment. They were on the verge of divorce when they came to us for consultation. During the batch treatment, it so happened that they could consummate exactly on their 4th wedding anniversary day, and we had a very grand celebration. These are the logbooks which the couples have to maintain daily. There are many more pages. So here is the statistical data of our work. You can check these later. We were going out for the picnic, you know. Okay. So yes, empowering couples through holistic therapy to help them achieve a positive sexual health and also to improve their overall relationship dynamics is indeed possible. But it needs a lot of dedication and teamwork. praying that we get the strength and guidance to continue and improve on the work we are doing, and seeking your prayers and blessings also. Thank you for your patient listening.
Amazing, amazing, Dr. Sita. I must say, amazing. Very nicely you have covered all the points what the patients are usually demand for these days. Amazing. Lot of activities also you have planned in this. Very nice, very nice. May I request Saiti, please make it a spotlight so I can ask some questions also to me and Sita ma'am.
Okay, ma'am.
Saiti? Yeah, yeah.
Yes, ma'am.
Yeah. Sita madam, as these days, lot of the patients are coming to us for this loss of libido. Usually, for the secondary infertility, usually once the patient comes, once we ask the history, yes, most commonly they tell there is a female partner has lack of sexual interest and loss of libido. So once we check, usually find sometimes yes PID or sometimes there is mental stress. So my question is based on, yes, first and foremost, they ask about the diet. As we all know, I am getting the patients who all of the Google savvy. They know the dark chocolate, they know the watermelon, they know the garlic, they know the fenugreek. They know the today only I have seen one patient. The patient told me, ma'am, I have taken the pulse. उड़द दाल भी मैं खाता हूँ. अब इसमें और क्या रह गया जो ये सब मुझे पता. I know the garlic, I know fenugreek, everything. So anything else you want to add? What I have missing?
So actually, thank you for that question, Dr. Ritu. And actually, it's not just about adding what is needed. It's also about avoiding what needs to be avoided. Because gut health, importance of gut health and sexual health cannot be overemphasized, So gut health is important for all aspects of our health. We are all realizing the importance of gut microbiome. So to avoid unhealthy food, to avoid foods which causes that is a problem with gut bacteria, that's also very important. So that means, yes, refined food goes out of the thing, and unnecessary antibiotics, unnecessary medicines which we gobble, all those things have to stop. Eating on time, everything is important.
Thank you so much, madam. Yeah, Dr. Ashok sir has raised the hand. Sir, you want to ask any question? Samiti, please unmute him. Unmute the sir. Dr. Ashok
Yes,
sir
ma'am,
has raised the hand.
I have given permission to everyone to
Yes,
unmute.
yes. Yeah, Ashok sir, you can ask your question. No problem. I think by mistake
Ashok
it
sir,
has
we
happened.
cannot hear you, sir.
So meanwhile, I will take the another question that is from Dr. Shirish Malde. Welcome, Dr. Shirish sir. Thank you for joining. His question is, in batch therapy and group discussions, have you come across any issues related to confidentiality and identity of the client couple?
I didn't get the question. That is within the group, you mean, or outside to the public? What do you mean? I didn't get the question.
Dr. Shirish, will you please specify? Ashok sir, you can write, otherwise she has unmuted you also. Dr. Munde, any question from your side?
Actually, no question. But what sir want to say is maybe if you are treating the couples in a group, is there any confidentiality broken, or is there any hesitancy in the couples? It may be the thinking of that, sir, whatever he is asking. But according to me, actually speaking, madam is doing really a great job, because she is giving importance to the history. It is very, very necessary. Confidential is one of the aspects of this education and the behavior and the whole treatment of the couple. Third one, there is no need of any medicine for this sexual activity. No need. It is because of the lack of the confidence. It is because of the lack of the um, uh, cooperation. It is because of the lack of the knowledge regarding not actually knowledge of the activity. It is the knowledge about the persons in between, husband and wife, maybe friend and the both may be the friends, but issue arises when there is no mutual understanding, there is no perfect maturity between them. If it is said that if you are mature enough, if you are having the knowledge of each other and knowledge of the system, knowledge of the sexual activity, then there is no need of any medicine for this activity. Sometimes loss of libido is because of the behavioral differences, and behavioral differences comes across because of the, again, depreciation of knowledge, again the confidence in between the mutual persons, and if it is achieved, then the uh, sexual life is actually a heaven. In Khajuraho, I have visited. There is a temple which is scripted by the temple constructors. Very beautiful Kama Sutra pictures are there. All the 84 positions are there, and the importance is given to the penis, importance is given to the semen, importance is given to the vagina, importance is given to the intimacy, importance is given to the both the parties. It is very, very
Yeah.
sacred science. It is very, very sacred science of, and it is the Indian culture. Actually,
Correct,
it is very
correct.
beautiful, beautiful culture of the India, which has given to the whole society in the world, which needs to be understood.
Yeah.
Once it is
Yeah.
understood, there will be no any question, there will be no any controversies, and the life will be very beautiful, very,
Yeah.
very beautiful.
Correct, correct. Thank you. There is one more question from Sharad Jain, sir. Sir, welcome, sir. Sir's question is, educated couples can accept to come together for holistic approach, but if female partner is not accepting to visit the doctor, what you suggest?
Okay, see, that is, it's a misconception or a myth that what we think that only educated couples will come for holistic approach. I would say that nothing is further from the truth, because in our batches, that is, we have, that is in one particular batch itself, we have people who have been educated only up to 10th standard, and people who are doctors or engineers or in the IT profession. So education and that is readiness for holistic approach, they don't go hand in hand. And if the female partner is not accepting to visit the doctor, see, initial visits are only just the initial phase. That is, we decide about the treatment, we decide about when the couple has to come for treatment, all that much later, not just during the first consultation. So later on, either or one of the partner, whoever is not interested or whoever is hesitant, they will also become interested. So that's our experience. And those who are really not committed, they won't come also.
Correct, correct, correct. So thank you once again, Dr. Sita Madam, for answering all the queries. I think we have not received any more questions. We are receiving the appreciation. So thank you once again for accepting the invitation and enlightening all of us. May I request Saiti, will you please show the certificate of appreciation?
Yes, ma'am.
Sita Madam, this is a small certificate of appreciation from our side for contributing as a distinguished speaker for today's session. Thank you once again for joining us and sharing your knowledge with all of us. Friends, before we wind up, there is one small announcement. I will post the flyer tomorrow. On 23rd of this month, I am having one webinar. I am speaking on the female sexual dysfunction, breaking the silence. That is accredited by the 1 credit point from MMC, Maharashtra Medical Council. I will post the flyer tomorrow. So those who are interested, please do join. That is on 23rd at 7 p.m. 7 to 9:30 is the schedule. My talk will be at 7 to 7:30. So all of you are welcome to join for that session also. So once again, thanks to all of my dear friends who have joined all across the geography. And thanks to Sahiti and thanks to Shield Pharma also for always ready for giving me the platform. Thank you, Tajwa, for joining. With this, we will wind off. Yeah.
Thank you.
Yes, ma'am.
Bye-bye.
Thank
Good
you
night.
so much.